faculty, fellow graduates, students, members of the School of Public Health community, and well-wishers, I stand before you today with a sense of privilege and as a reflection of the amazing power of diversity, academic excellence, and tolerance that's the hallmark of the School of Public Health here at the University of Washington. I first came to the UW 11 years ago, and at that time I was working as a medical officer in an obscure position in the Ministry of Health in Kenya, and I knew little of public health. And today I wish to pay tribute to Ruth Ndwati from the University of Nairobi, who piqued my interest in public health. And I also recognize my mentor, Kari Fagwa, who is faculty here at the school, who supported me as I pursued my Master of Public Health here, and even thereafter. And in fact, Kari Fagwa has dutifully worked with me step by step in my academic journey, and I wish to dedicate this day to her. It's at UW that the motto of science, passion, and enduring impact was ingrained in me, and I applied these guiding principles during the interim before I came back for my PhD to establish strategic partnerships between government, international agencies, and communities to deliver some of the largest HIV prevention programs in Africa. I strongly believe that public health programs should be designed rigorously, should be delivered with fidelity and high integrity, and measured with the appropriate metrics. This is the work ethic that I owe to the University of Washington. My research applies innovative techniques to deliver and evaluate interventions aimed at reaching out and testing sexual partners of HIV-infected persons. The findings will hopefully transform HIV testing policy not only in Kenya, but globally. And I dream of a time when, at least in Kenya, every HIV-infected person would know their HIV status, would receive immediate HIV treatment, and would be able to lead a healthy and productive life. And I would count on the long-standing collaboration that exists between UW and Kenyan institutions to achieve this noble dream. I'm grateful to the faculty, staff, and students from the Department of Global Health for the support and mentorship. I say thank you to Steve Gloyd, who I see over there, to the team, including Kenny Shea and Emanuela Gakidu, for the faith they had in me. And indeed, when I joined the PhD program as the first student in implementation science, I was not sure about the trajectory that my coursework and research would take. And thanks, however, to an amazing team at the Department of Global Health, and I particularly wish to recognize Dan Boog, program advisor, with whom we navigated the uncharted waters of a new PhD program together. I salute also my student colleagues with whom we have bonded and created friendships that transcend boundaries and will last a lifetime. I will continue to tap into these relationships as I begin the next phase of my career. As a first graduate in metrics and implementation science, I am aware of the onerous task ahead of me, and I commit to work together with the faculty from UW to continue to define the field of implementation science, to mentor upcoming scientists, and to increase the utilization of implementation science methods amongst government agencies, funding agencies, and academic institutions, particularly in Africa. And I'm confident that I'll accomplish this mission because I know that I stand on the shoulders of giants. I feel empowered, sharpened, and reconfigured, and I'm ready to go into the world of global health to make a difference. I also leave here knowing that I'm part of the heritage of the School of Public Health that Dean Frumkin always keeps reminding us of, that of courage, passion, and perseverance. And I will certainly draw on the expansive global health connections of King Holmes and Judy Wasserheit and others to build networks not only for myself, but for my fellow global health graduates. Collectively, we have the ability to transform global health. We will certainly take part in the bet, the 15-year bet that we've just heard about, and we will transform global health, whether we choose to work locally or globally. And I promise to play my part in maintaining the reputation of UW and also being a true ambassador of UW in Africa and beyond. So my wish then is that my children will follow in my footsteps, make the wise decision, and elect to study at the University of Washington. Thank you.